Good morning and welcome back to the channel. I hope that everybody is doing well. So today is going to be episode 1 of my Think Thursday series. I kind of briefly touched on it in my previous video, but my goal is to post every Thursday a topic that pertains to working in healthcare as a nurse practitioner. It will likely be pulled either from case studies or my board's prep material, but it's going to be useful information to students studying for their board's exam, nurse practitioners, just entering into practice, or even established nurse practitioners that just want to freshen up and make sure that they're doing the most current evidence-based practice. And so I asked on my previous video if you guys would rather see urgent care content or boards prep content. All the feedback I got was urgent care content predominantly, and also just educational. You guys, I know you really like the educational content, and I love making this because it keeps me on my toes, and it keeps me, like I said, I like to stay current too, so it gives me all the excuse to just constantly research and study, and I do love to do that. So for today, we are going to be doing our first topic for Think Thursday, and it is in regards to testicle pain. So I just recently did a women's health and men's health webinar. It was like a couple hour lecture on the two topics, and that was one item that I pulled from my presentation because it's so important. Working in the urgent care, I do regularly see the chief complaint of testicle pain. It is a common chief complaint, and it's really important that you are familiar with how to manage this if it comes into your clinic. And so it'll just be a brief overview of what to look for, what you should do in your exam. All right, so let's just dive right into our first Think Thursday topic. All right, so for today's Think topic, I want you to think about what you would do if you were working as a nurse practitioner and you read this chief complaint for your first patient. Patient is a 28-year-old male, presents to the clinic today with unilateral testicle swelling and pain. His vitals are 103 heart rate, 99.9 temperature, and a blood pressure of 132/86. Obviously, you are going to go in and assess your patient. But first, let's think what questions you should ask this patient. When did the pain start? Was there trauma? Are there any other symptoms? So for example, nausea, vomiting, fever, discharge, or dysuria. Is the patient sexually active? Is there a concern for STD? And has this ever happened to them before? All right, so let's say that the patient gives you this information. Patient states that only the left testicle is painful, swollen, erythematous, and it does feel warm to the touch. The pain started 2 days ago and has gradually gotten worse. Patient is sexually active with the same partner for the last 6 months. Denies condom use and a history of known STDs. He also denies any trauma to the testicle or history of testicle pain in the past. Patient endorses mild nausea and denies fever, vomiting, discharge, or dysuria. So what tests do you think you should do in this situation? With the complaint of testicle pain, you should check your patient's cremasteric reflex and also for the Pren sign. So how do you perform these tests and what do they indicate? So to perform the cremasteric reflex, the examiner strokes the medial superior thigh, which causes the cremasteric to contract and which pulls up the testy on the same affected side. If this reflex is not intact and your patient's testicle does not lift with this exam, then it indicates a problem with the spermatic cord, which is highly indicative of testicular torsion. So let's say in this circumstance, the patient's cremasteric reflex is intact. What about the Pren sign? A positive Pren sign is when the patient's testicle pain is alleviated when the scrotum is elevated. So the pain gets better when the testicle is lifted. So let's say during your exam, your patient has some relief of testicle pain when the affected testicle is lifted. So your patient has a positive Pren sign, and their cremasteric reflex is intact. So with this information, what do you think that your next step should be? With this patient, you should order a urinalysis and a urine culture with studies for both gonorrhea and chlamydia, being that those are the two most common STDs. You should treat this patient with antibiotics empirically while awaiting those test results. The treatment for chlamydia and gonorrhea includes doxycycline 100 milligrams twice a day for 7 days, and that covers for the chlamydia, and then 500 milligrams IM of Rocephin, which covers for the gonorrhea. If your patient is unable to take doxy, for example, if they have an allergy or if they are pregnant, 1 gram of azithromycin is the alternative treatment for that. This, however, is not the preferred choice due to building up of antibiotic resistance. So with the information that we have now, what do you think the likely diagnosis of this patient was? If you guessed epididymitis, then you are correct. Acute epididymitis is the number 1 cause for testicle pain in adults that present in the outpatient setting. Gonorrhea and chlamydia are the most common causative agents in males under 35, and then there's enteric pathogens such as E. coli, which are the more likely causative agent in the older populations. For those patients where STD is unlikely and we're considering more enteric pathogens, then empiric antibiotic choices should include either Bactrim or fluoroquinolones. Patients should generally improve within 48 to 72 hours after starting antibiotics. If this is not the case, then a further evaluation is indicated. Generally, this would include a scrotal ultrasound and a urologist referral. All right, so that finishes our first Think Thursday topic. Hopefully you guys learned a little bit. I promise you, you will end up seeing testicle pain in your practice. You will see it on your boards. It is just a common chief complaint. It's really great because there are a couple of really easy diagnostic tools that you can do in the office that make it really easy to determine if they need to be, obviously referred to a higher level of care if it's torsion or if they can be managed outpatient. And I meant to put this in the presentation, but one way that I kept it straight in my mind was the acronym PPE, positive pren equals epididymitis. I didn't include that in the presentation, so hopefully you stuck around to the end to hear that. But that was the way that I kept signs kind of straight in my head versus epididymitis or torsion. PPE, you can all remember PPE. If you're working in healthcare, you know about PPE. Positive pren is epididymitis, meaning that so when you were to lift the testicle or elevate the testicle, they had some pain relief. There's inflammation there. And so when you take off that pressure, then there is relief of pain. Remember, it's not going to do that if there is torsion. Lifting the testicle is not going to give them any pain relief. The problem isn't inflammation. The problem is with the spermatic cord. And so just to keep it fresh in your mind and keep them straight, just think of PPE. Positive pren is epididymitis. If the cremasteric reflex is not intact, then we're concerned for torsion and we send them to the ER. All right, so that's going to complete it though for today. Let me know what you guys thought about it. You can always leave in the comments down below if there's a topic that you would like to see me briefly discuss here on the YouTube channel, and maybe I'll pull from that and get some ideas from there. I definitely have some ideas going forward of things that I want to discuss, but I am always listening, and if there's some topic that you would like to see, just put it in the comments down below. Let me know what you thought about today. I hope that it found you to be helpful in your practice, in your studies, and I wish you guys, nothing but the best. Don't forget to learn something new every day, and until next time, we'll talk soon. Bye.